Hi there, this is Dr. Evan Osar. Welcome to video 2 of this IMI series where we're looking at training the anterior chain or that flexor chain, incorporating the abdominals, the hip flexors, the psoas into optimal alignment and control of the thoracolpelvic cylinder as well as the hip and pelvic complex. In the last video, we looked at the modified dead bug position and how we activate, or how the cues that we use to activate the psoas. Now we want to take this into the upright position, because remember that even though the lying down position is a very functional position, we also want to train these muscles to work in the upright position. The modified wall plank is one of our go-to exercises for training the hip flexor complex along with the entire flexor chain or the anterior stabilization chain in the upright position. So I'm going to have Mel put her hands against the wall in a modified plank position. I want to make sure that her wrists and elbows are straight, spine is long as if she's being pulled from the back of her head, scapular stable, the thorax is aligned and stacked over top of the pelvis, the legs are straight, she's up on her toes, the heels are raised. She's going to think about that psoas connection, the psoas from that lesser trochanter up to the spine and inserting into the diaphragm. She's going to think of a wire connecting from the front of her spine to that lesser trochanter of her hip. She's going to keep her core activated, not braced, not squeezed, not tight, just active. So it's active but not locked down. She's going to maintain a nice neutral lordosis of her lumbar spine, maintain natural curves of her spine, maintain that slight anterior pelvic tilt, and not tuck herself under like that. Keep a slight anterior pelvic tilt so she maintains that lumbar lordosis. She's going to begin by thinking of that wire connection and bringing one knee up towards her chest as long or as high as she can without changing the lumbar spine. So wearing a sports bra is great, or I'll put my hands on her lumbar spine to make sure the lumbar spine does not move, so that hip flexion does not change the lumbar spine position. She comes back down, stabilizes, and then alternates the other side. So there should be no transition or weight shift from side to side. Her core should be able to maintain this alignment and the lumbar curve with hip flexion. Back down, and she'll do 2 more repetitions on each side. So maintain that nice long spine position, no change in that thoracolpelvic cylinder alignment. Nice, back down. So very excellent pattern to train TPC stabilization with hip flexion. And one more time each side. So again, she's getting stabilization on her stable leg, and now she's getting hip flexion on the side that's flexing. Stable flexion. So we have mobile side and a stable side, and she's maintaining TPC alignment. What a lot of our clients will do during this pattern is they will bring the hip into too much hip flexion. So go ahead, and what they'll do is they'll start to posteriorly pelvic tilt and go into lumbar spine flexion and back down. So they're overusing their abdominal wall to pull that hip up. They don't have enough range of motion in their hip, so they'll start to go into that posterior tilt. One more time on the other side, and you see you're going to a posterior pelvic tilt and lumbar spine flexion. This is a non-optimal strategy for this pattern. We do not want hip flexion to create posterior pelvic tilt and lumbar spine flexion when the hip is only at 90 degrees of hip flexion. We want our clients to be able to maintain hip flexion through a neutral range of lumbar lordosis. So we're going to train them to maintain that alignment and control. We do not want them going into a range where they're losing the ability to maintain that lumbar spine, that lumbar curvature, and the anterior pelvic tilt. In the next video series, I'll show you another functional progression of using that flexor chain or that anterior stabilization chain in a resisted type pattern. This is Dr. Evan Osar with IMI. I'll catch you next time.